Hey everyone, we're back live. This is Dr. Eric Block, your host of our weekly I Love Dentistry Facebook Live with Blocky, where we discuss a topic for the day with a member of the group. And thank you so much for joining me and all the members on Facebook that are watching now or the recording. We truly appreciate it. And today we are joined by Dr. Jason Portnoff. Jason, thanks so much for joining us.
Thank you for having me, man. I appreciate it. This is awesome.
So Jason Portnoff is a DMD, MD, FACS, FICD, and he also has like a million other letters after his name, but it would take way too much time to say them all. Actually, the topic for tonight is new practice, organized dentistry, and digital workflow. So we'll get into a bit of that. And Dr. Portnoff is a practicing oral and maxillofacial surgeon and owner of Surgical Arts of Boca Raton, Florida. He is president-elect of the Florida Society of Oral Maxillofacial Surgeons, treasurer and past president of the Florida Cleft Palate Craniofacial Association, and a director of the American Dental Society of Anesthesiology. Man, that's quite the resume you got going there.
Thanks, man. Yeah, I mean, yeah.
I was gonna say quite the resume, but an even better beard.
Yeah, I've been working on this. I got rid of it for a while after the pandemic kind of cleared its head, and then I grew it back because I'm trying to hide some double chins that are down here, and maybe a little beard will make me look more distinguished. I don't know.
That's exactly why I grew my beard, is to hide my double chin. But it keeps creeping itself around. Hey man, so Dr. Portnoff and I, we graduated Nova Southeastern together in 2002. Then I did an implant residency, which brought me back up to Boston. And we could spend, I think, 30 minutes alone just on the Florida boards, and what a crazy experience that was back in 2002. But tell me a little bit about after Nova. You went on to great things after dental school. Tell me all about what you did. And
on an aside, I think that the Florida boards are going to be shifting towards a mannequin only, not live patient exam. But we'll see what happens with that. But that's what I heard in the grapevine. But yeah, so after dental school, after we did that monstrosity of a board exam, I went up to New York. I did a residency oral maxillofacial surgery at New York Presbyterian Weill Cornell Medical Center. I did med school there, did a year of general surgery there. So that was 6 years. Then I did an extra year I did in Australia, Melbourne, Australia, which was great. I did pediatric maxillofacial, cranial maxillofacial surgery. I was at the Royal Children's Hospital. That was awesome. Best year ever. If I wish my ancestors had gone right instead of left, leaving Russia, and then we had settled in Australia, because it was pretty awesome there, so, but they didn't want to keep us there. When you're an American, you can train there, that's fine, but they want you out, so as soon as your visa is out, you have to leave. And basically, you'd have to redo dentistry, you have to redo the residency training to actually practice in Australia. So came back to the States. I taught for a few years. And in the end, I ended up teaching at Nova for about 8 years. And then I opened up my own practice about 3 years ago. So actually just over 3 years ago, December was my 3rd year anniversary. So now we're in our 4th year right now in Boca Raton. So it's called the Surgical Arts of Boca Raton. My office is on the campus of a hospital. I'm at West Boca Medical Center. And it's great. I treat patients in the hospital. I treat patients in my office. I'm still active on staff with the oral surgery residents at Nova. And I actually have medical students from Nova. They have an MD medical school now. It used to only be osteopathic med school, but now they have an MD allopathic school. And the students rotate through my office as their first clinical experience right after their preclinical textbook years. So they get to see what a oral surgery and a clinical practice is like.
So you did 4 years of dental school, and then you did 4 years of medical school after?
So I did 6-year residency, which included basically 3 years of med school. The 4th year being an elective year, they let me do that on oral surgery and oral surgery rotations. So, but they held that certificate, that medical degree, until I was done. And then I just had basically a year of general surgery, and my chief year of oral surgery left. So I finished the whole thing up in 6 years, med school, general surgery internship, oral surgery residency. So while I was in med school, I was actually, still on oral surgery. I had oral surgery responsibility. So I'd be like rounding with the residents, 6 a.m. Med school would start at like 8. So I'd be there, tired, scrubs, pager, in a biochemistry class. Then, pager would go off. I'd go to the ER, sew up somebody's lip, come back, missed half the lecture, be like, what I miss, nobody wanted to talk to me. They thought I was some weird kid, and meanwhile, I'm older than everybody else in the class, because I already finished, dental school. And that was it, so I just, I went through that, and then, finished that up, then did general surgery with all those same students, the medical students. And now those guys, those students that I was in med school with are all graduated, and they have really, like, they are established in their field. Each one of them, when I see their name, in the news or on LinkedIn or something, it's like they've done great things. I'm like, oh man, I was the slacker, like the dental.
You were the old guy in the back of class that kept
Yeah.
getting up and leaving when your beeper went off.
Yeah, exactly. 100%. They're like, who's that weird guy? Is even, who is that guy? Is he in this class? What's he doing here?
And then what was the year in Australia?
That was great. So that was a fellowship year. Actually, so I was after my training, my 6 years of residency, I was deciding about a fellowship, and I was applying, and I got into two. I got into one in Australia, Melbourne, Australia, and I got one in Pittsburgh. And actually, the guy that helped me choose between the two, I'm not joking, was President Clinton. So he was at the hospital. We were treating a friend of his, basically, and he was visiting. And so we got to speak to him because we were on this treating staff. And he's like, what are you doing next year? And I was like, well, I'm choosing between fellowship in Australia or a fellowship in Pittsburgh. And he's like, go to Australia. I'm like, oh, the leader of the free world tells me I have to do it. Like, he wasn't president at the time, but I mean, you got to take, what he says. Actually, here's my that day. This is my claim to fame right here. My 10 minutes of that's me and the boss right there. So,
nice.
Yeah, he told me to go to Australia, so I did, and it was great. It was an amazing experience. I learned a lot. I explored. Was able to travel around Australia. I went to New Zealand for a convention one week. It was great, amazing experience. So for anyone who didn't get to study abroad at some point, if I recommend it. It was amazing. So, a lot of good friends I made, so, and I keep in touch with them still, to this day. So it's really a great experience.
And was that focused on pediatric care?
Yes, it was pediatric maxillofacial. It was cleft palate, bone grafting, orthognathic surgery. We did a lot of cranial vaults. It was a department of plastics and maxillofacial surgery. So actually, there was a plastic surgery resident and an oral surgery resident. We worked together on lots of stuff, and clinics and OR cases. It was really amazing, tremendous experience. So I really appreciated it.
And then you started up your practice pretty close to right before COVID.
Yeah, perfect timing. Really great on my part. Well thought out. I've been in academics for a number of years, and basically I was, grass is always greener on the other side. And I was like, I really, I'm going to open up my own office. So I was always looking for specifically, like, if I was going to open my own office, I wanted to be on a hospital campus, first floor, in the medical office building, so I could go back and forth easy. I wanted to have, a special layout of my office, which is basically how it's set up, where you have two waiting rooms, so the post-op patients don't, scare off the pre-op patients, and, that I learned actually from my years of private practice before I went into academics. Basically, I was in his office, and I had a guy we had treated in the hospital for facial fractures. He's super swollen and bloody, and he's black eyes and swollen up, and he's sitting there in the waiting room. A little girl, 16 years old, is about to get her wisdom teeth out, sitting in the same waiting room. And she turns to him, and he turns to her, and he's like, "What are you here for?" She starts saying, "What are you here for?" She's like, "I'm here to get my wisdom teeth out." She's like, "What are you here for?" He's like, "I have my wisdom teeth out." Like, basically totally scared her off. She was freaked out. Now I had to deal with trying to calm her down and explain, no, this guy's just, he was in a bar fight, you know what I mean? Like, it had nothing to do with his wisdom teeth, so, it was great. But so I set up now my office with a, waiting room for pre-op, a waiting room for post-op. It doesn't commingle. And actually with COVID, it made it great because it was a great workflow, to keep patients away from each other. And it just happened to work out that way. So, but yeah, I mean, I really am happy with the way it's set up. It was just, COVID was a challenge, obviously, to everybody, and nobody had the answers. So everybody's kind of winging it as we're going. And but I think we managed to pull through it. I think things are different now than they were before. But we always, as dentists, had great infection control policies and practices. So I don't think it was that hard for us to adapt and work for a good future.
Yeah. So, I mean, opening up a practice is hard enough. Opening a practice up and then getting hit with a global pandemic is even harder.
Yep.
And, oral surgery is such a different animal than a general practice. We're looking to try to get patients directly in the office where you're looking for that, but you're also trying to build these referral relationships.
Yep.
And so there's so many factors that you ran into. How did you get by through COVID?
Yeah, so it was tough. So, basically, one of the big things that we try to win over our general dentists. We want to show them what we can do. Why refer to me when you could refer to somebody else? What do I have that another oral surgeon or dental surgeon has that, what am I doing differently? So you can't really showcase that when you're trying to keep social distancing. So we were trying to do some CE courses. We try to do some Zoom CE. But it got a little, everybody's got CE zoomed out, I mean, basically, so yeah, it was tough, but, I did maintain my connections with the hospitals, and I had a lot of referrals that way. And, word of mouth, helps, and I think part of it is, I find that the communication and constant contact with my, dentist referrals, or dentist, like a patient will come to me, they weren't sent by a dentist. They need a tooth extracted. They found me from their insurance plan, or they heard about me from a friend or something. And so I make sure to ask them, who's your dentist, right? Oh, it's so-and-so. Okay. I call that dentist and I make sure that I close the loop, hell, I'm seeing your patient today, or I saw him, I'm seeing this afternoon, or just saw him, and we treated this. And I think this is a great idea if we can, try to get a treatment plan together. And by working with the dentist, I think that people, long for that communication and that teamwork. Some people are out there, as solo practitioners, they don't really talk to their referring dentist, and by that lack of communication, why would you refer to that guy? He's not communicating with you. You're not getting to a follow-up. You really have to make sure you're constantly in communication. And so now a text here, a Zoom, a Zoom meeting if you can, or now that we're starting to meet each other in the office with masks and everything like that, we can communicate and build on those relationships. But I think it's huge. I think you just have to make sure you contact a few dentists every day. Make sure that you have active patients that are getting care, and you're following up with them. If they have medical issues, you're following up with the medical doctors, and you're just constantly talking about the patients with the providers. You're not living like on an island, alone, and just treating things your own way without communication. I think that's key.
Yeah, especially a new office like yourself, keeping that going. It's not like your practice has been around for 40 years and you can just expect those referrals to come in. You had to keep that baby rolling.
Yeah.
What's it like now? Are things, do you think, settling down? Do you think
Yeah, I mean, I'm in Florida, so it's different than the rest of the world. You know what I mean? So part of the time we don't even acknowledge there's this pandemic. You know what I mean? Like, so, but I mean, I joke, but there's a little truth to that. I do think one of the things that I've done in my practice to try to encourage, the referrals and communication is, we're going basically digital almost completely. So, I will scan patients with an iTero scanner for their bite. If a dentist doesn't have an iTero scanner, it's great because I have now a tool that they can start using through my office, to help them. So, let's say I place an implant, I have a CT scanner, I'm doing everything, computer assisted surgical planning, I'm using Anatomage software, and I'm putting an implant in, making sure I got enough bone, scanning the patient, and I can send those files or even screenshots of those images to my referrals, and I'm like, hey, look, this is what we have planned. What do you think? Are you on board? Yes, great. Okay, then let's do it. But I don't do anything without getting like a thumbs up. The last thing I want is for me to do a surgery, have it go back to the referring, restorative dentist, and it's not what they had in mind. And now they're upset. They can't treat the patient as they wanted, and maybe that would be an upset patient. Who knows? But so I like this. The digital workflow has really helped. Even to the point where I can send the digital images to the lab of the referring dentist, and basically the dentist contacts the lab, I contact the lab, and it streamlines everything for them, so that basically the patient has less chair time. It's really been phenomenal to help build the practice.
Yeah, it's great. I mean, digital, especially with implants, it's great for referral communication. It's great for marketing, but
Mhm.
I mean, I've said it a million times. It's made doing implants one of the more enjoyable procedures that I do. So much less stressful. I've pre-planned everything.
Yep.
They go so much quicker.
Yep.
The patients are happier. We're happier. It's win-win.
I think even patient education, I can show them on the screen. Here it is. This is your mouth. This is the missing tooth. This is the implant I'm going to put in. Look, this is the brand of implant I'm going to put in. I mean, like it can all be shown to the patient. They get a better understanding. Otherwise, if they don't know what we're talking about, what I mean? Like, I'm going to put a screw in your jaw. Like, what I mean? Like, let me just explain to you really what we're really talking about here, and visually they can appreciate it. So I think that helps.
Yeah, the digital plan. I do the same thing. We do this. We do a CBCT. I'll do a digital scan. I'll put up the plan right in front of them. I'll put the implant, in the area so they can see what it looks like.
Mhm.
And then I, usually will schedule them in at least a few days or a week or so, and I'll print my
Yes,
own
it's your
guide.
guide. Yeah, it's great.
Yeah.
Yep.
Quick waiting room story. You were talking about having two separate waiting rooms.
Yeah.
My third week out of dental school, my third week in private practice, I had a patient that came in, and I wish you were set up because I would have referred them down to Florida. But I tackled a tooth that was beyond my comfort zone, and this was in an all Brazilian dental practice. I was the only one that didn't speak Portuguese.
Right.
So the patient comes in, and I thought I was going to be a hero and save the day and extract his. It was number 30. It was all by itself, and he was in pain. And I was going to save the day, and he was going to say obrigado, and I was going to extract that tooth. And after about 5 minutes of cracking the root tips, my assistant said, "Doctor, he can't breathe." And this is
Oh
in
God.
Portuguese, and he's having a panic attack. And I didn't know what to do because I had taken CPR, but until you're actually faced with a medical emergency, I realized that I had a long way to go, and Blocky was in the real world now. And
Right.
so we called 911. The ambulance came, and they took him right out the front door through the waiting room on a stretcher, and took him in the ambulance and drove him off. And on the outside, I was calm as a cucumber. On the inside, I was having a panic attack. I
Right.
literally went to the waiting room and I just said, "Who's next?" The next person got up, they put their
Left the other
magazine
door.
down, and they walked right in,
No
and they
good.
came right in without any questions. I'm like, the last guy just left on a stretcher, but
Yeah.
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 So
That's awesome.
anyway, yeah,
Yep.
quick
No,
story.
listen. I mean, that's stuff that as oral surgeons, we do that stuff. We train. We do anesthesia. So I have my office constantly doing anesthesia drills. You know what I mean? So we run little mini codes, fake codes. I had a guy come in with a mannequin and hooked up to monitors, and we were basically running through codes. What would happen if this happened? Here's the EKG. What do you do now? Throw this med. Administer this med. Now the EKG is this. So we run those codes in the office. And I'm also thankfully on the campus of the hospital. You know what I mean? So God forbid, I need to go 911. I'm right there. But we run the codes. I have in my office actually. I'm lucky. I have my staff is great. I have a phlebotomist, one of my dental surgical assistants. One of my surgical assistants is actually a periodontist from Brazil, and another one of my surgical assistants is a paramedic. So I'm like, I make sure that we're covered. You know what I mean? So we can run through these drills and everybody knows what's going on. But everyone in my office is ACLS certified and PAL certified. So we can run codes, and we practice them. We practice them at least once a quarter. And we do constant, I make my staff watch videos about emergencies, and from like the American dental ASDA, or I'm having them watch the videos for that, for that extra training so that they understand what's going on. And I want them to, realize what could be going wrong and how to treat it. So we don't want the first emergency to happen and nobody knows what's going on, that's, we have to have it, down to a science before there's a problem. So there isn't a problem, basically.
And you're anesthetizing these patients. You're putting them to sleep. So there's that
Yeah.
whole other risk factor.
Yeah. So sometimes I think, the scariest part, the most dangerous part is the sedation. Like, so the dentistry, the oral surgery is not the problem. Like that can be done. It's the medications that we're giving a patient to put them to sleep, to make sure that they're, in a comfortable, sedated place and safe. Like that's the unknown. How they're going to react. Maybe it's the first time a patient's having anesthetic, or maybe, they didn't tell you everything about their medical history, or they took themselves, benzodiazepine before they came to the office just to take the edge off, but didn't tell you about that. And now as you're pushing your medications, they're a little bit more sleepy than you expected with the medications you gave, and then when they come out of it after you've had your panic, and the surgery's all over, and you wake them up and they go, "Oh, doc, I forgot to tell you, I took, 3 Valium before I came in today. I was so anxious." I'm like, "You got any more for me? Because I'm having a heart attack right now." Like, it's so, sometimes, your patients aren't always truthful with you, and you got to be able to, figure it all out. It's like playing house MD every patient, so, but that's why we got to train and keep keep practicing what we do.
Quick follow-up to my story, because this is now all become all about me, but that patient ended up having nowhere to go. He had no family, no friends that we could contact, and he came back so sedated. They must have pumped him up with so much Valium that we had to put him in one of the extra dental chairs, and he slept there for like 4 hours until he was ready to leave.
Yeah.
So that was the end of that
Yeah.
case. Tell me about organized dentistry. You're very, very involved with local, state, national organized dentistry.
Yeah, I have been. And it's weird because I never thought I would be when I was in dental school. Like I always kind of, we would go for the free pizza, but, after that, I, be out the door, but as my, after residency and training, and I started working, and, I realized how important, this is to our profession, and, protecting what we do, as dentists, as oral surgeons, every aspect is always, threatened by somebody, like whether it's a dental therapist that, is going to be practicing dentistry, they say in a remote, underserved area, to do, simple dental, procedures, or it's a, as oral surgeons, we provide anesthesia, but maybe, the anesthesiologists are threatened by us providing the anesthesia in our offices, and they want, to come into the office and change the model that we're practicing. So it's kind of, it's interesting. So, dentistry and oral surgery, it's been done a certain way for, many, many years. And, you have to protect, our field and expand where we can and where we should, and also realize our limitations. And I just do think that having a voice is important, so like this year, I'm now the president-elect of the Florida Society of Oral Maxillofacial Surgeons. And I got involved with them a number of years ago, and I really got to enjoy it. One is the meetings is great. It's great for, passing ideas around with your colleagues, and, what do you do in your office, for implants? What system are you using? What are you using for anesthesia? Anything, it's great to have new ideas. You don't want to be on that island. You want to have colleagues to bounce ideas off of. And then as far as general dentistry groups, I'm getting more involved with the Florida Dental Association, the Atlantic Coast District Dental Association. I think it's great. Your referrals are in these groups, and, you have to protect, our practice, and it's great. I really find it very interesting to just see how the machinery runs in these organizations. So I recommend any new dentist getting started to not forget about, being involved with these organizations. Pick one that's interesting to you, and go to meetings. And then if they have an opening, where there always is an opening, to get involved with, a committee or, a position, I just recommend doing it. I think it's valuable lessons to be learned there, so I recommend it.
Oh man, that's great advice. One final question I wanted to ask you is about your therapy dog. Tell us about
Yeah,
Rosie.
yeah, I got her here with me. Let
Let's
me.
see her.
Yeah, Rose, baby, where are you? Rosie's sleepy. She's a little bit tired right now, but I'm gonna bring her
She's
to the.
sedated.
Yeah, she's sedated. Come here, Rosie. Oh, you
Oh
got.
yeah. Hey Rosie, therapy
This is
dog.
our
Tell us about
office
it.
therapy dog.
Yeah.
She's a golden retriever. She's just under 2 years old, and she's actually so she's great. One is her temperament is amazing, right? And I just want to show you, she's actually becoming a certified therapy dog, right? This is her work hours as she's getting her credits. So, but kids come into the office, they're afraid. Even adults, they're afraid. They don't want to be in the dental office. They're dental phobics, whatever. And we do our best, music, lighting, everything like that to calm people. But when I see that they're totally freaked out, my next question is, so do you like dogs? They're like, yeah, I love dogs. All right. Most people do, but if they don't, this kills the conversation right there. But if they do, most of the time they do. I go, listen, I got a therapy dog here. She doesn't go into the procedure rooms because want to keep things clean. But if once you're done with your procedure, come and pet Rosie, our therapy dog. The kids love it. They're all like, oh, I mean, they can't wait to get their tooth extracted just so they can run back here. And when they come for, their post-op visit, it's like they can't get out of the chair quick enough to go pet Rosie and, give her hugs, so it's great. It makes, and for me, in between patients, if I have a stressful patient or a stressful procedure or whatever it is, I come in there and I pet Rose. I'm like, Rose, it's going to be okay, right? Everything's going to be okay. Like just hug her a little bit, get my composure back and go see the next patient, so she's a therapy dog for everybody, for me, for the patients, for my staff, it's great, so Rosie's.
We'll have to touch back in and have a little ceremony for her when she gets her diploma to be a
Absolutely.
certified therapy
Absolutely.
dog. Yeah. Awesome.
Perfect.
Dr. Portnoff, thank you so much for joining me and all of the members on Facebook that are watching now or the recording. We truly appreciate it, and we'll see you next week. Dr. Portnoff, thanks so much for joining us.
Thanks for having me. Good to see you, man. Appreciate it.
All right, buddy. Take care. We'll be in touch.